Over the last 10 years, the Department of Radiology at the University of Florida College of Medicine has conducted a simulation-based evaluation of radiology resident competence in critical care imaging. 328 residents interpreted this case of colitis as one of 65 cases during an 8-hour simulated on-call shift, with a median score of 2 out of 10 and an overall average score of 3.79 out of 10. On average, 5.99 points out of 10 were lost due to missed observations. At the same time, 0.22 points were lost due to interpretive errors. We define an effective report to be one which achieves scores between 7 and 10. In terms of letter grades, this would be an A or a B. In this most missed case, 27% of residents produced effective reports. We define a report having a critical error to be one with scores between 0 and 2. In terms of letter grades, this would be a D or an F. In this most missed case, 68% of residents produced reports with critical errors.
This study is a supine and upright abdominal exam, which was requested to evaluate a 59-year-old female who was having abdominal pain, and the clinician in the emergency room was specifically concerned for the presence of free air. On the upright exam, which is the best view to look for free air, we do not see any free air under the upright hemidiaphragm. On the supine exam, which accompanied this study, you can see that there's a loop of bowel that's coming across the top of the abdomen here that is consistent with the transverse colon, and there's actually indentations on the wall here, which is also referred to as thumbprinting. And when you see that finding, you need to be thinking about things that might cause edema of the colonic wall. So you want to be thinking about things like infection, colitis, an inflammatory colitis, or ischemia. Any of those three things could potentially be causing this finding, and you want to make sure that you notify the emergency room physician, because this is a acuity priority, and you need to let the doctor know that the patient has colonic edema and they may need additional imaging to further characterize it.